Study Session 6. Stages of Human Development. Introduction. In this study session, we shall describe the two major stages of human development. These are the prenatal stage and postnatal stage. Learning outcomes. When you have studied this session, you should be able to 1. Highlight the stages of the prenatal stage of human development, and 2. Discuss postnatal development. Prenatal stage of human development. In this section, we shall describe the first stage in human development. This is called the prenatal stage, which can be categorized into conception, fertilization, zygotic, embryonic, and fetal stages. Conception stage. This occurs during copulation, that is, sexual intercourse. It is a stage when the male organ, penis, enters the female organ, vagina, and the male egg cells, spermatozoa, are deposited in the vaginal cavity. The male eggs so deposited find their way into the female womb, uterus, to meet the female egg, ovum, inside one of the fallopian tubes to fertilize it. Usually, 1 or 2 of the male egg cell, spermatozoa, get into the tube. Others become destroyed in the vaginal cavity after some days. Conditions in the vaginal cavity, that is, acidic conditions, can destroy all sperms deposited. Fertilization stage. This stage occurs after conception. Fertilization refers to the union or fusion of the male egg cell, spermatozoa, with the female egg, ovum, which take place in the fallopian tube. However, if there is no union between the two egg cells, fertilization will not occur. The egg, ovum, will die naturally and come out as messes. During the process of fertilization, the chromosomes that carry the genes donated by the sperm and the egg, ovum, get organized and paired up. This process takes about 24 hours. Bonnie and Rosa, 1998. Half of the male egg that fuses with half of the female egg produces a whole cell. This means that they undergo the process of cell division to produce new cells. Human cells have 23 pairs of 46 chromosomes, but have from each partner, that is 23 chromosomes from the male and 23 chromosomes from the female, fused to give a complete 23 pairs or 46 chromosomes. It is the single cell that makes up an offspring, as shown below. Since the ovum always carries X sex chromosome and the sperm chromosome X or Y, it is the male that determines the sex of the child. For instance, if the X sex chromosome donated by the father, male, is dominated by X sex chromosome of the mother, female, female child is produced. If the Y sex chromosome of the father dominates the X sex chromosome of the mother, male child is produced. Fertilization may not take place if the fallopian tube is blocked or twisted. Zygotic stage. This is a stage where zygote is formed. The fertilization egg, ovum, is called a zygote. The formation of zygote occurs 2 weeks after conception. During the stage, the zygote floats down the fallopian tube towards the uterus womb and attaches itself to its wall. The cells divide into different forms. For example, placenta. This is the network of blood vessels attached to the mother's uterine wall. It carried food and oxygen to the developing embryo and removes waste. Embryo. It takes the zygote about a week to get into the uterus, where it burrows into the uterine wall and becomes well implanted to form the embryo. The embryonic stage falls within the trimester of pregnancy. It begins about 2 weeks and ends 8 weeks after conception. There are many factors affecting the implantation of the zygote in the uterus. Half of all zygotes are successfully implanted, while about half are aborted spontaneously. Borner and Russell, 1998. According to Robert and Laura, 1975, and Simpson, 1993, genetic conditions, nutrition, and exposure to environmental toxins, for example, cigarette smoke, partially explains why only about 1 zygote in 4 survives to become an embryo. Fertile stage. This is the period between 8 to 36 weeks or 40 weeks after conception. During pregnancy, the fetus goes from making simple reflexive body movements such as twisting to making more complex reflexive behavior such as swallowing and sucking. At 36 weeks or 40 weeks, the fetus is capable of being born by the pregnant woman since it has all its parts well formed. This is a normal baby. Any fetus born at 28 weeks of pregnancy is a premature baby. Such a baby needs special care and handling. The fetal stage ends the prenatal stage of human development. Factors affecting prenatal stage of development. Some biological and environmental factors affect the prenatal stage of human development. According to Mojonyola 2000, these are the following. Genetic factor. This refers to the hereditary features or the potentialities a neonate acquires from one of his or her parents. For example, a child may acquire his personality profile. For instance, being gentle, aggressive, etc. from the parent when the chromosome fused or acquired criminal tendency when he or she gains extra chromosomes, that is XYY or XXY chromosomes. Chemical factor. Drug or other chemical substances taken by the mother during pregnancy can affect the neonate when it crosses the placenta barrier. For instance, tetracycline capsule causes yellow discoloration of teeth of neonate, and so on. Nutrition. Poor or imbalanced diet can affect both the expectant mother and the yet unborn child. For example, anemia in pregnancy and improper growth and development of fetus. Smoking. Nicotine inhaled by the fetus from a pregnant smoker can affect its proper development and respiration. It can also lead to premature delivery. Age of mother. Vesicovaginal fistula (VVF). Premature babies and infant mortality are very high in mothers who are less than 20 years of age. Those that are above 35 years may also experience series of miscarriages and infant mortality. Radiation. Exposing a pregnant woman to X-ray films and other forms of radiation can cause her to have disabled or abnormal child. Emotional state of the mother. Negative emotions such as fear, worry, and anxiety can cause threatened abortion. Other factors: illness, that is mental illness, viral infection, position of the embryo, blood factors, size of pelvis, blocked tube, non-functional ovum or testis, and so on are other factors that can affect the prenatal stage of human development. Postnatal stage human development. Postnatal stage of human development refers to life outside the mother's womb. It refers to human development that is more observable than what obtains in the womb. Simply, it refers to the development of human beings from birth till death. It includes the following stages, namely neonatal, childhood, adolescence, and adulthood stage of development. Neonatal stage. This refers to the period immediately after birth till about a week or 2 weeks, that is 0 to 2 weeks. It is a time when the neonate is recovering from the birth trauma and trying to cope or adjust to the new environment into which he or she is born. Mojoyola, 2000. At this stage, the baby, that is the neonate, has to make psychological, physiological, and social adjustments to the new environment. Thus, in order to develop well, he has to adjust to the following in the environment outside the mother's womb. A. The light brought by the day and the darkness brought by the night. B. Change in temperature, that is, from hot, altering, to the unstable, past altering environment. C. Breathing of oxygen exchange. D. Feeding when hungry or feeling thirsty. E. Elimination of body waste. F. Need for sleep, rest, and exercise. G. Handling by people. And H. Noise and various threatening forces in the environment. The neonate is a remarkable, capable organism. From the moment he begins to breathe, he can see, hear, and smell. He is sensitive to pain, touch, and change in position. At this stage, he is helpless, naive, and dependent on other people for help. He performs most of his actions by means of reflexes. Among these reflexes are the following. A. Rooting reflex. Turning of head to a particular side when the cheek is touched. B. Sucking reflex. Sucking of objects that come in contact with the mouth. For example, nipples of breast, fingers, etc. C. Withdrawal reflex. Sudden jerking away of leg when the sole of the feet is stimulated. D. Grasp reflex. Tightening of the fingers around an object. And E. Swimming reflex. Floating of the neonate in water. Other reflexes of the neonate include Moro and Babinski reflexes. Childhood stage. This can be classified into 4 stages, namely A. Infancy, that is 2 weeks to 2 years. B. Toddler, that is 2 to 3 years. C. Preschooler, that is 3 to 6 years. And D. Middle childhood, that is 6 to 9 years. As from the end of the 2nd week of delivery, that is infancy period, the child begins to learn, grow, and mature into adult human species, acquiring physique, motor coordination, intelligence, social, moral dependency, and definite style of expressing his emotions. Therefore, at childhood, the child manifests different types of development, which include physical, motor, cognitive or intellectual, emotional, and social development. Motor development. This refers to the term given to the development of muscle coordination. Its rate depends on the maturity of child's nervous system. As mentioned earlier, at birth, the neonate depends on the reflexes for his motor activities, and as he is growing up as a child, he is able to perform some motor activities, which may be in form of hand, leg, or body movement. These motor activities are in stages, easy to see and measure. At 6 months, for instance, children can reach for or grasp objects in their hands and transfer them from one hand to another. At 8 months, they can hold things between fingers and the thumb. Around the first birthday, tiny objects can be picked up between the thumb and the first finger. A 2-year-old child can hold a pencil like an adult and unscrew a tab from a container. In terms of locomotion, a child, according to Chalona et al. 1996, sits on a chair at 6 months, stands with support at 7 months, crawls quickly at 10, walks holding one hand at 11, pulls up a furniture to stand at 12, crawls upstairs at 13, stands alone unsupported at 14, walks alone at 15, runs and picks things up without falling over at 24, stands on toes, jumps up at 30, stands on one leg at 36, and walks downstairs with one foot on each step at 48 months. Cognitive development. Cognition refers to all the mental processes taking place in the brain, such as reasoning, thinking, memory, judgment, and so on. Cognitive development covers the development of knowledge, perception, and thinking. Piaget gave 4 stages of cognitive or intellectual development in children. And these are sensory motor stage. This is the period between 0 to 2 years. During this period, the children learn to differentiate themselves from other objects. They learn to know that objects still exist even though they are no longer visible. At this stage, they have little intelligence, though they show rapid perceptual ability. By the time they are 2 years, they can look for objects that may have rolled away to a hidden place. For example, toys, balls, etc. Thus, at the end of the sensory motor stage, the children are to internalize picture memories in their mind. They remember images and make sense of objects they see. Pre-optional stage. Pre-optional state means pre-logical. Pre-optional state is the period between 2 to 7 years during which children learn language and make use of symbols. Their perpetual ability is limited at this stage. Hence, they only categorize objects with salient points, such as calling all 4-footed animals dog. They are realistic and take any law given to them by their parents seriously and challenge them if they violate such law. They cannot reverse figures or numbers at this stage. Concrete optional stage. It is a period between 7 to 11 years during which the capacity of children changes considerably and signs of maturity are shown in them. At this stage, the children are capable of logical thinking. They can reverse numbers and conserve numbers, mass or volume. They can order objects and classify them using more than one characteristics. They are able to use comparative language, for example, shorter or longer than, when comparing, separating, or arranging objects in a distinctive group. Formal operation. This is the period between 11 years and above. At this stage, children are logical in their thinking. They are capable of thinking in abstract terms and solving difficult problems. They can give reasons why things happen or why one object is different from the others. Social development. This refers to the growth of patterns of social behavior in the child. As a social animal, the child reacts to his social environment by sensory motor. His attachment with the mother forms the bias of his social development. This becomes easier as he develops verbal utterances. As he interacts with mother and other people in the social environment, the child becomes very developed socially. His level of interaction determines his social development. Generally, at 6 to 8 months, children ignore one another. At 8 to 13 months, attention is given to one another. At 14 to 18 months, attention to one another increases. At 19 to 25 months, children engage in more social contact, for example, smelling or laughing at people. Emotional development. According to Iyola 2000, a child at birth has no definite emotion. Rather, it shows a generalized excitement. He gave the description of emotional development of children as follows. At birth, till about 3 months, that is 0 to 3, the child shows generalized excitement, reacting to any stimuli that comes its way. B. Between 3 and 6 months, that is 3 to 6 months, the child's emotion branches into distress and delight types. Distress type includes emotions such as fear, anxiety, rage, anger, depression, or sadness. These are negative or unpleasant emotions. C. At 12 months or above, emotion of delight branches out as feelings of elation and affection, for example, joy or happiness. These are positive or pleasant emotions. D. At 18 months, emotion of jealousy is added to the distress emotion. And E. At 24 months, the child shows all kinds of emotion, distress and delight emotions. Postnatal stage of human development does not stop at the childhood period. It moves on to adolescence and adulthood stages. Therefore, in this study session, we shall describe the development of human beings at both stages and as well highlight the tasks individuals are expected to perform. Adolescent stage. This is a transition period. This is a transition period between childhood and adulthood. It is a period when the individual becomes biologically matured. It is the puberty period, during which an individual becomes capable of sexual reproduction. It encompasses all the physical changes that occurs in the growing boy or girl as the individual passes from childhood to adulthood. It is a period between 12 to 17 years in some cultures. Adolescent stage is associated with puberty. Puberty derives from the Latin word pubertas, which means adult. Steinberg, 2002. It is a period when an individual enters adulthood life. Characteristics of adolescent. According to Marshall, 1978, adolescents manifest 5 physical characteristics at puberty. These are the following. 1. A rapid acceleration in growth, resulting in dramatic increase in height and weight. 2. The development of primary sex characteristics, including the further development of gonads or sex glands, which are the testes in males and the ovaries in female. 3. The development of secondary school sex characteristics, which involves changes in the genitals and breasts, the growth of pubic, facial, and body hair, and the further development of the sex organs. 4. Changes in body composition, specifically in the quality and distribution of fat and muscles. 5. Changes in the circulatory and respiratory systems, which lead to increase in strength and tolerance for exercise. Each of these sets of changes is a result of development in the endocrine and central nervous systems, many of which begin years before the external signs of puberty are evident or even before birth. Sternberg 2000 gave the sequence of physical changes observed in adolescents at puberty as follows. Characteristics as well as age of first appearance, that is years. 1. Growth of testis, scrotal sac, years between 10 and 13 and a half. 2. Growth of pubic hair, years between 10 and 15 years. 3. Body growth, years between 10 and a half and 16 years. 4. Growth of penis, years between 11 and 14 and a half. 5. Change in voice, that is growth of larynx, years about the same time as penis growth. 6. Facial and underarm hair, age about 2 years after pubic hair appears. Table 6. Physical changes in boys. Table 6.2. Physical changes in girls. Characteristics, and then on the other part of the table, age of first appearance, that is years. 1. Growth of breasts, years is between 7 and 13. 2. Growth of pubic hair, that is between 7 and 14. And 3. Body growth, years is between 9 and a half to 14 and a half. 4. Menarche, that's years for that is between 10 and 16 and a half. 5. Underarm hair, years about 2 years after pubic hair. And 6. Oil and sweat producing glands, it occurs when glands are locked, years about the same time underarm hair. Developmental task of the adolescent. The developmental stage an adolescent finds him or herself poses a number of problems for him or her. For instance, he or she is faced with the problem of identity, body physique, career choice, and so on. These are the development tasks before the adolescent, which are highlighted below. Achieving emotional independence of parents and older adults. Attempt to detach him or herself from parents and older adults to gain self-identity has always been a problem to the adolescents. For example, wishing to be living alone, to get married early, etc., etc. Achieving new and more mature relationship with age mates of both sexes. There is a task or problem of relating with their peer groups of both sexes, including those approved and disapproved of by their parents. For example, wishing to move with gangs of tramps, smokers, etc., in position of their parents' wishes. Accepting one's physique. The physique, for example, short stature, large breasts, etc., always gives the adolescent a lot of problems. He or she has to adjust to his or her body constitution. Achieving control over sexual maturation. Adolescents are sexually capable of producing offsprings, but are not ready to care for the offspring. This is an area of conflict with the adult. Choice of career. Adolescents have many job opportunities, but they are faced with the problem of what they will become career-wise in life. For example, lawyers, engineers, doctors, etc. Thus, they need to be properly guided in choosing careers. Preparing for marriage. Adolescent boys and girls have the problem of choosing a wife or husband. They move with chains of boys or girls, and as a result, may not be able to have a good selection. Other developmental tasks for the adolescent is how to achieve social roles and grasp the philosophy of life. Adulthood stage. This is the period after adolescence. It falls between the age of 21 years till death. Therefore, adulthood is that period from age 18 to death. B. 1996. According to her, adulthood stage can be divided into 5 stages, namely young adulthood, that is the period between ages 18 and 25 years, early adulthood, the period between 25 and 40 years, mid-adulthood, the period between ages 40 and 65 years, late adulthood, the period between 65 and 75 years, and late adulthood, the period between 75 years until death. Young adulthood from 18 to 25 years. According to B. 1996, this is the developmental stage when most young adults A. complete the major part of their education, which requires intensive learning and remembering. B. must separate from their parents, establishing an independent existence. C. typically had more major roles than at any other time in their lives, for example, work and marital roles. D. change jobs more frequently and move more frequently than any other age group, producing higher total numbers of life changes than any other time in life. E. are likely to have the dirtiest, least interesting, least challenging jobs, and to like their jobs less than any group. F. rates of self-reported loneliness or higher among adults in this age range than in any other group. G. depression is more likely in this period than at any other period, except possibly late adulthood. H. These are the years in which the body and the mind are at their peak. I. experience stress and deal with it by creating a network of relationships. J. experience high marital satisfaction until birth of first child. And K. demonstrate high cognitive skills on most measures. According to Penny and Hahn, 2000, developmental tasks for the young adult are forming an initial adult identity, establishing independence, obtaining entry level of employment, assuming responsibilities, developing parenting skills, social skills, and intimacy. Early adulthood, that is from 25 to 40 years. From 25 to 40 years, early adult are blessed with peak or near peak physical and moral functioning. The individuals at this stage have enough energy for a 50 or to 60-hour work week, or for keeping track of several small children, or both. This is a period of highest social status, or a period of settling down in both work and family life. It is also a time when the conformist or conventional worldviews begin to give way in the life of an early adult to a more individualistic approach. In other words, it is a period the early adult experience increase in independence and autonomy. The adult individual at this stage A. experience good physical functioning and health in most areas. B. experience peak period of cognitive skills on most measures at about age 30. C. are dominated by family roles with continued differentiation of gender roles. D. experience lower marital satisfaction. E. have few new friends. F. place major emphasis on work or career success or progress. G. rare family. And H. increase self-confidence, independence, or autonomy. Middle-age adulthood, that is from 40 to 65 years. It is during these years that the first sign of physical aging begin apparent, such as loss of nearness of the eye that makes most adults require glasses for reading, loss of elasticity in the skin that makes wrinkles more noticeable, the diminished reproductive capacity that is most noticeable away women, the heightened risk of major diseases, for example, cancer, heart disease, etc. Generally at this stage, the adults experience A. physical decline in some areas. Areas like strength, elasticity, height, cardiovascular functioning. B. some signs of loss of cognitive skills. C. added role of care of elderly parents. D. increased marital satisfaction. E. more intimate relationships. F. high work satisfaction on average. And G. also at this stage, the adult individuals launch family, redefine life goals, and achieve individuality. The developmental task of the middle adult, among others, include achieving generativity and reassessing the plans of young adulthood. Late adulthood from 65 to 75 years. These are the years when some adults experience significant diseases, for example, heart diseases or chronic disabilities, that is, chronic arthritis. Physical changes or declines continue to accumulate at roughly the same rate as was true in one's middle years. Therefore, the late adulthood is a period when the adult experiences A. more noticeable physical decline, which is relatively slow, hearing loss, memory loss, or arthritis. B. slow reaction to time. C. Small declining in virtually all crystallized and exercised skills. D. Ground parents' role and significantly less dominance of family and gender roles. E. High marital satisfaction for those not widowed. And F. More intimate relationships between siblings and friends. These are years of retirement for a vast majority of adults. Furthermore, tasks of ego integrity, perhaps a feeling of more inferiority, may reach an integrated level at this stage. It is a period when the adults have to cope with retirement, declining body and mind, redefining life goals and sense of self. Therefore, the developmental tasks of elderly adults at this stage are expecting the decline of aging, maintaining high level of physical function, and establishing a sense of integrity. Late adulthood from 75 years until death. This is the stage of human development when the process of physical and aging rarely accelerates. It is at this point that the functional reserve of many physical systems is likely to fall below the level required for everyday activities. Pendergast et al. 1993. Creating a new level of dependence or disability. Therefore, it is during this stage, that is about 70 to 75 years, that acceleration in the decline in total mental ability score starts. As one is moving to 80s and beyond, the incidence of physical and mental fragility rises rapidly. Grolnick and Simeon-Sick, 1993. Thus, at this stage, many old adults may not be able to use public transport, and getting to church becomes more of a strain to many of them. Old adults usually experience the following. A. Since widowed is also the norm at this years, those old adults who still live independently are spending more time alone. B. He may go to fewer club meetings or other group gatherings, but they still keep in touch. C. Most old adults maintain regular, if reduced, contact with their children, with other family members, and with their friends. D. There is acceleration in the rate of cognitive decline at this stage, particularly in memory. E. Family and work roles are relatively unimportant. F. Possibly, the period is one of the reminiscence when the old adult comes to terms with his or her own life and with the reality of the coming death, cope with illness or disability, etc. The terminal stage is therefore the period of ego integrity versus despair. Study session summary. In this study session, we noted that the prenatal stage marks the beginning of human development. It is a stage between conceptions till birth. It is subdivided into conception, fertilization, and zygotic, embryonic, and foetal stage. Some biological and environmental factors that affect the prenatal stage of development are genetic, age, nutrition, chemical or drug use by the expectant mother, and emotional states. We also discussed that the neonatal and childhood stages of development are parts of the postnatal stages of development. The stages include neonatal stage, adolescent stage, and adulthood stage. That ends study session 6. Thanks for listening.